My name is Colin Mitchell. I am a student studying the Specialist Certificate in Empowering Health in Aboriginal Communities with Melbourne Uni. I am also an Aboriginal Liaison Officer based at Diabetes Victoria in Melbourne. The project I'm going to talk to you about is developing a diabetes support group template for ACOs, Aboriginal Community Controlled Health Organisations, so they can then go on and design their very own support groups, mainly to support the high statistics of Aboriginal people managing diabetes. And to ensure the project is culturally safe and appropriate, the support groups will be based in their own ACOs. ACOs actually provide all the health services to Aboriginal people and have the resources. The inner focus is about empowering Aboriginal people to manage their diabetes appropriately by gaining a better understanding. The goal is it will put diabetes back into their own hands. So the purpose of my project, and this is the first phase, Aboriginal people have the highest statistics of diabetes in Australia compared to the non-Indigenous population, with type 2 being more prevalent. So we want to support Aboriginal people managing diabetes. We are 3 to 4 times more likely to be diagnosed with type 2 diabetes compared to other nationalities in this country. Also, the mortality rate for Aboriginal people connected to diabetes is 12 times higher than the non-Indigenous population, which is a worry. So we want to delay the onset of chronic conditions connected to diabetes through education and support. Also, Aboriginal people's quality of life seem to deteriorate once chronic conditions set in. So the purpose of my project too, that indicates that more education and support need to be done with community members diagnosed with the condition. Another barrier that has impacted Aboriginal people was being denied a basic education due to the racism in this country. Information is power, and being denied that eventually started the ball rolling with a bad health status. It's the main reason why Aboriginal people find medical jargon almost impossible to understand. Another important aspect is that Aboriginal people often learn better in groups alongside other community members because it makes them feel more comfortable and they are more inclined to share their experience with their diabetes, and that way they can touch base with each other on different experiences. Group participants will learn off each other. Also, the group will receive the latest diabetes information with good management advice. So, filling a gap in services, we think diabetes support groups will fill a lot of them gaps where because there are a lot of diabetes services out there, but there are no dedicated support groups. If you want to make change, support groups are pivotal for Aboriginal people. It will also create a better support pathway for Aboriginal people with diabetes. This project will fill a gap where there are no diabetes support groups. So my quote is, it's hard to see someone suffer from something that can be managed. Now, the benefits of the project: community diagnosed with diabetes will get a better understanding whether they have type 1, type 2 or gestational. Diabetes information will be delivered more culturally and appropriately, so it's easier to understand. Community will create a healthier lifestyle to help themselves with their diabetes management and also eliminate the onset of chronic conditions connected to their diabetes. They will also have the confidence to live with diabetes, and it will also take the stigma out of diabetes, not to mention the shame factor. So how to implement this project? Well, I'll network with the peer support program at Diabetes Victoria, also network with VACCHO, Victorian Aboriginal Community Controlled Health Organisation. They are the peak body in Aboriginal health, who we also have an MOU with through Diabetes Victoria. We will also network with the ACOs, who would be heavily involved, engage Aboriginal health workers, who will also be trained to deliver this project. And we are also conducting a diabetes statewide community consultations with questions on diabetes support groups. So we just want to get an idea out there of what community think of support groups, how they can help them, and probably the best ways to disseminate information with them. So the stakeholders in this project would be the Aboriginal community affected by diabetes, naturally, Diabetes Victoria Peer Support Program, and VACCHO, as well as all the ACHOs and their Aboriginal health workers, who would be pivotal in this project. Now, the barriers to the project, the COVID pandemic would be a problem regarding lockdowns, but we will overcome this by providing an online platform for ACOs and Aboriginal health workers. So the conclusion to this project, you will have Aboriginal community members affected by diabetes, but they will be empowered and confident to manage it. Aboriginal community members affected by diabetes will also create a better quality of life for themselves. They will also go on to promote diabetes and create more awareness to community and, more importantly, to the next generation. They will also avoid future chronic conditions with good management. Also, a healthy community who knows all about diabetes, and I think everybody wants a healthy community out there. So thank you, everybody, and that is my project.
Hi all and welcome. Thank you so much for joining me today. It's an honour to be presenting at the University of Melbourne conference. My name is Chanoa Cooper. I'm a Moribund, Wiradjuri and Filipino woman from regional Victoria in Shepparton. I'm a part-time student at the University of Melbourne, currently studying a specialist certificate in Aboriginal health in rural communities. I come from a strong line of Aboriginal leaders such as Uncle William Cooper, a political activist and community leader, and also Uncle Sir Doug Nichols, who's a sportsman, a pastor, and also an activist. I'm also an auntie, a daughter, and a niece who's very passionate about community development and Aboriginal health. I'm a project officer for a local Aboriginal cooperative, working in the space of aged and disability. So today I would like to share a community project that we'll be delivering hopefully this year. The project focuses on wellbeing and connection for our elders. I've chosen the name in traditional Yorta language. It's pronounced Natyan Yapinayebuk, meaning gather together. Now, where are we located? For those of you that don't know, Shepparton is located within the Goulburn Valley region of Victoria. We have a population of over 66,000. We hold a significant Aboriginal cultural heritage here and is one amongst of most culturally diverse regions in Victoria. Historically, we're made up of 8 clans that are within this region who identify as Yorta Yorta, Bangarang proper, Kalithraban, Walithika, Moiraban, Yalupna, Quat Quat, and Yalaba Yalaba. So the project is a health and wellbeing retreat primarily targeting our elders with aged care packages within the Golden Valley region. So it's designed to really focus on that social inclusion and various cultural forms. So the retreat, it encourages community members to engage with such events to not only build social support networks, but also that physical health and longevity. The aim is really to provide positive impacts for a social network to improve the ability to cope with stressful situations, alleviate the effects of emotions and distress, and gives our elders the opportunity to culturally practice. As we all know, in 2019, COVID impacted our healthcare systems, which has caused the global pandemic. During these unusual times, the response was to stay at home and quarantine. So with these border closures and travel restrictions in place, obviously we were all meant to self-isolate and practice social distancing in our homes. And throughout the development of this project, I was actually asked to justify as to why I've chosen to do a retreat. And after doing some research, I had found an interesting literature from J. Milroy stating that the COVID pandemic has highlighted and reinforced the gaps for Aboriginal people and Torres Strait Islanders, including racial inequities and social determinants of health. All these factors that influence the health and mental health outcomes of COVID-19 also affect an individual's ability to achieve health and wellness. So this really reinforced the importance of cultural connection and social inclusion, particularly for our elders. So J. Milroy continues to say that the need for Australia to recognise Indigenous peoples, to enhance relationships of reconciliation and healing the relationships is essential now, particularly during these unprecedented times. So initially we had intentions to deliver the retreat in early October. However, COVID restrictions at this time unfortunately restrict us to do so for the time being. So we've pushed back plans to hopefully schedule it in for November this year. So now you may be asking, why are we specifically targeting our elders? So the reason for that is our elders within our community, how COVID has really impacted their mental health. It's increased depression and anxiety levels, which is quite alarming. So in our communities, you see elders play a significant role in Aboriginal communities. Traditionally, our elders are pivotal contributors and hold crucial roles for both formal and informal education in our communities. And from a hierarchical standpoint, our elders in the community are respected for their knowledge, leadership, and abilities for making decision-making on behalf of our community. So now, I'm going to read a beautiful quote about our elders. So please feel free to close your eyes or sit calmly and listen. The role of elders is difficult for outsiders to understand. We rely strongly on them as key decision makers within families. They are the people we hold the greatest respect for. Because of them, we went through so much, so that now we do not have to suffer the injustices they experienced. Their guidance is often illustrated through everyday life, and their teachings are often done subconsciously. We follow, we observe, and we go on to teach our families. It is through our elders that the spirit of Aboriginal people is kept alive, which is a beautiful, beautiful quote. So going back to the retreat, so the retreat activities include, cooking classes. We want to have, yarning circles. We would love to have some musical entertainment by local Aboriginal Artists, we would love to invest in Aboriginal businesses to deliver these services. And we've also conducted a community consultation as to what the elders would love to see at this retreat. And that's what we've taken into consideration. So we hope to provide a space where elders can sit around the fire, share stories, feel the ground and the earth between their toes. The goal is to really capture these stories and preserve them for future generations. So where is the retreat going to be delivered? Our department has found 2 stunning locations on the border of New South Wales and Victoria, located around on our country. So option 1, Morning Glory. So Morning Glory is based on the New South Wales riverbanks and offers villas and camping grounds, and also offers function and conference facilities. Here's the accommodation. So as you can see, it's got a really beautiful rustic feel to the accommodation. Option 2 is Moama on the Murray. So this is also situated on the Murray River. Moama on the Murray offers accommodation options, sort of like a resort style feel. And once again, the accommodation for Moama and the Murray. So the outcome for this project is to make a positive, impactful experience for our elders. We really want to be able to reduce the loneliness, depression, anxiety that they've expressed to us. We really want them to develop further friendships, increase community socialisation, in a really controlled and safe environment for them to do so. So really, the local Aboriginal cooperative Wanyarra, it really lies within our responsibility to be able to make sure that our elders are not only cared for, but also provided a high level of healthcare, particularly during the pandemic. So this piloted project will be measured by feedback that we collect after the retreat. You know, we would love to increase the participation number and hope to open it up to more elders across various regions in conjunction with other Aboriginal cooperatives as well. Would love to see it grow in the future. So we've come to the end of the presentation. Thank you for listening in. We're really excited to be delivering such a significant, impactful cultural retreat for our elders of this community. And, you know, we really hope that we can deliver this if COVID restrictions allow us to do so. So thank you all.